take a picture, then it will be easier actually to understand. If this is the uterus, the whole uterus, and the baby is inside like that, this is the placenta. So, if the patient had a cesarean operation before, the operation would have been done at this part. This is where we make an operation and get the baby out like that. In somebody who had a cesarean like this before, if the placenta happens to be here, it will go out through this previous cesarean scar and then get into the bladder, get attached to the bladder. So there will be more bleeding when you do the operation. So what we have done is develop an instrument which will stop the blood supply to this area, so that we can separate the bladder from the placenta without much bleeding. So that is the technique I was trying to tell.
Okay, so
I can put this instrument so that the bleeding will be much less, and when the bleeding is less, complications will be less.
So the equipment are there?
It is there. We have developed it and we are promoting it. In Kerala we have done now many cases like that, and the bleeding during this operation will be much less when we have that instrument in use. So that's the principle.
So how much does it cost?
The cost is very little actually. We had to. This is a clamp we call it.
Okay.
3 of those clamps will cost only 15,000 rupees, 15.
Okay.
Very cheap. So we can use it during this operation. If you use that clamp, bleeding will be much reduced.
The techniques of using these clamps should also be demonstrated to...
Yeah, that was shown by the video by me, and it is very simple to use. Ordinary this gynecologist can use it actually. That is the simplicity of it.
So this is the latest device being used?
Yeah, one of the things that we have developed which has helped us a lot in reducing the blood loss during operation, bleeding during operation. And when the bleeding is more and it happens very fast, when the bleeding is very fast, we may not be able to replace blood immediately. We may not have blood, even if we have, it is not possible to replace blood immediately. And then what happens is when the bleeding is too much, immediately they collapse. When they collapse, the heart stops, cardiac arrest occurs. And that is how we lose these patients during operation.
So what is the rate of death due to this sort of bleeding?
Up to 7%. Such complicated cases, up to 7% can be...
Life can be saved?
Life can be lost. If you don't take proper care and proper technique is available.
So what is the share of MMR, maternal
due to hemorrhage?
Due to
bleeding, 20% of deaths in MMR in Kerala is due to bleeding.
And overall in India?
In India it may be more actually. Bleeding is taking about 20 to 30% in different parts of the country.
So this is very serious sort of problem being
faced. This is not the reason for that many deaths.
Okay.
This is only one of the problems. This will be more later. But now the main problem for bleeding is after the baby comes out, the uterus will not contract. If the uterus contracts, bleeding will stop. So uterus may not contract in every case. So that is the main cause of bleeding and bleeding to death.
How can the uterus be contracted?
There are medicines available which we give immediately and properly, that will reduce the chance of the bleeding. If it doesn't work, we have to immediately open the abdomen, operate, and then there are different techniques of stopping the bleeding from the uterus.